let's welcome Michael Maurer of Novant Health Rehabilitation Services. Mike, we are so glad to have you on the show. For those who haven't had the chance to meet you yet, will you share a little bit about your background and your education?
Certainly, yeah. So I have a doctorate of physical therapy from Youngstown State University, which is in Northeast Ohio. Before that, I was at Slippery Rock University in Western Pennsylvania. I moved down here about 5 years ago.
That's awesome. A lot of education to get to a doctorate.
Yeah, so physical therapy at this point is a doctoring profession, so it was a big push by the American Physical Therapy Association to make that a 7-year degree, so a lot of schooling.
Yeah, plenty of school behind you. And now you've been out working as a physical therapist for several years, right?
Yeah, it's going on like 6 years now. I've been primarily in outpatient orthopedics.
Okay.
When I began working for Novant in June, I started actually working at the hospital too, so it was a nice little change, kind of mixing things up.
Gotcha. And you're with Novant Health Rehabilitation Services, right?
Correct, yes.
Tell us a little bit about that role.
So right now I am one of 2 physical therapists that work out of the Main Street office in Charlotte. We also have 2 physical therapy assistants there, and so while we're there, we're doing evaluations and then co-treating with the PTAs to kind of get our patients better. Okay,
great. So Novant Health offers in-hospital as well as outpatient services.
Correct. Yeah. So in the hospital, it's a lot more, being a part of the, care team, which kind of makes up the patient, case management, PT, OT, physician, nursing, kind of work together with them to really figure out, what's the next step for our patients? How do we make them better? How do we provide exceptional care to those patients?
Nice.
And then, in the outpatient clinic, it's a lot more about just, really narrowing down and finding, what's going on and, getting those patients back to their prior level of function.
Gotcha. In the hospital, I think of it as a PT, always the person making you get out of the bed and walk down the halls,
yeah,
right?
And that's where, so on the superficial level, it definitely looks like we're just getting patients up, but, sometimes you get those patients, particularly the ones in the critical care unit that really, need some of that clinical expertise on, what's the best way to move them? How do we do it? Where do we go from here? That sort of thing. Mm-hmm. And, we're really using kind of our minds as much as our bodies, but people don't really see that one.
Yeah, no, that's awesome. And then on the outpatient side, I love what you said about kind of getting people back to their prior level of functions. So talk a little bit about like.
Yeah. So, a lot of people think, their first reaction of PT is, after surgery or something like that. And that's very much a part of our, a process. If you get a knee replacement or hip replacement or something with your shoulder, you're probably going to have to go to physical therapy.
Right.
But we also do conservative interventions, so kind of pre-op or postponing those surgical interventions if they are down the line. And sometimes we get patients that they think they're going to have surgery, but they get back to 100% without surgical interventions because they did conservative care. It's really about kind of finding those objective deficits and really catering a comprehensive treatment plan to that individual.
So talk about those conservative treatments for people at home. What are some of the times that might be appropriate?
Honestly, any type of orthopedic issue, so muscles, bones, joints, those kind of common aches and pains. The thing I tell patients is, it's better to be proactive than reactive, right? A lot of times we grit our teeth and we kind of just continue on and we let things linger and we let it smolder until it's like this big fire that, we need to get something addressed. Whereas if we catch those orthopedic issues early, particularly things like knee pain, we can, narrow down and find, are you tight? Are you weak? Where are you tight? Where are you weak? Those sorts of things. Is it because you're sitting up out of a chair weird or doing stairs wrong?
Right.
And if we can kind of be corrective in that regard, we can definitely see positive change early. And so usually the earlier we get you, the quicker we can get them to go away.
So will always require a physician referral for something like that? Maybe somebody's sitting at home and they know, my back hurts all the time. Should they go to their doctor first or call you guys?
The awesome thing is that the majority of states, North Carolina included, have what we call direct access. So it is dependent on your insurance type.
Okay.
So if you have a commercial payer, your Blue Cross, your Cigna, your United, if it's a commercial insurance, they actually don't need a physician referral.
Okay.
They can come see us first, kind of cut through the weeds a little bit.
Right.
And then, we're really good at kind of diagnosing and knowing, all right, you will benefit from this, or we probably should, maybe investigate this a little further with your doctor. And we're always sending the plan of care. It's not like we're just on an island.
Right.
But if you have a federal payer like your TRICARES, your VAs, your Medicares, we do require a physician. Well, they require a physician's referral before you can be seen from us.
Okay, great. That's perfect information. And I think either path seems like a really straightforward way to get to you guys.
Honestly, yeah, and a lot of times, doctors, they're so inundated, right?
Mm-hmm.
They're so busy, and they want their patients to get better. And if you call and you can't get in for a week or two, that's where that direct access is nice, because if they hear that you rolled your ankle or you hurt your shoulder, they just, all right, I'll send the referral.
Let's go ahead and get that started. Yeah, that's perfect. So tell me, located on Main Street, how can people get in touch with you if they do have questions or want to schedule an appointment?
They can actually call our office at 910-721-3157. They talk to Jessica. Jessica's a great front office person. She'll kind of lead them down the path and kind of figure things out with them.
Great. Well, this has been very helpful. Thanks for joining us. We'll have to have you back soon to get more detailed on some other topics.
Definitely, yeah.
Good.